Hey everybody, Melanie here. And just first of all, I want to say hi and thank you to everyone who's been so nice to subscribe and leave comments and all your encouragement and everything. It really means a lot. And I appreciate each and every one of you. And I'm really enjoying learning about y'all through your videos and everything. So this is a great community. And even though those of us who are getting the duodenal switch are kind of rare, it seems like most of the people I've seen are getting the vertical sleeve gastrectomy, but we're all going through something very similar. So it's really encouraging and great to see how everyone's progressing. So consider yourself hugged from me. It's 2 days before I officially start the 800 calorie pre-op diet. I start that on March the 2nd. My surgery is March the 30th, and I'm having the duodenal switch. The pre-op diet is 800 calories, and it's going to be using these shakes and supplements and everything through my doctor's office. Now I know I could be using other things, but I don't want to tempt fate. I would rather use their program because it's worked for so many others, and they're the experts, not me. Now post-op is a different story. Post-op, I'm going to be using the vitamin regimen from Vital Lady, and I'm going to be following the diet recommendations of people who have gone through this. Lots of doctors, my doctor included, gives dietary and vitamin supplement advice to the duodenal switch patients that really is more geared towards Roux-en-Y and sleeve patients. Duodenal switch patients are an entirely different ballgame. Our vitamin requirements are much more stringent, and our dietary requirements are different because we are only digesting about 20% of all our fat intake, and only about 60% I think of protein. So we really have to up our calorie intake and up our protein and fat and back way off on the carbs for our surgery to truly work for us the way we need it to work for us. And our vitamins, we're taking a lot of vitamins. There's upwards of 20 some odd different supplements that I'm going to be taking. Not separate supplements, but like 20 or more than pills that I'm going to be taking each and every day for the rest of my life once I have surgery. That aside, what I wanted to talk about was upcoming. People have asked me, am I scared? As far as the surgery goes, no, I'm not. In 2015, I had 2 surgeries. I had a gallbladder removal, which was an emergency surgery. I was home one day and had extreme pain, and I thought I was having a heart attack. And my husband took me to the emergency room, and they gave me an exam, saw that I wasn't having a heart attack, but the doctor had the sense to mash in on my abdomen and, does this hurt? And I said, yes. And he said, you're having a gallbladder attack. And they did an ultrasound and saw big old stones in it, and they did remove it. And then towards the end of 2015, I had a lumbar fusion of L4 and L5 in my back because I had cysts on either side of my spine, along with stenosis and bone degeneration. So they needed to do a fusion. So having been under the knife twice last year alone, not counting other surgeries I've had in the past, I'm not afraid of it. Of course, I know things can happen. There's always that risk. But that's not what I'm afraid of. What I'm afraid of, I think, is what's going to happen to me. Not me body-wise, but me head-wise. Because I can already see changes. People that are constantly asking me, or that did constantly ask me about how things were going when I was going through the insurance appeals. Every other day I'm hearing, "Did you hear anything yet? Did you hear anything yet?" I was getting pissed. I didn't lash out at anyone, but I had to bite my tongue many times. If something changed, I would let you know. Don't hound me about it. And there are certain people in my life, family members and people that I work with, that a few that know about me having this procedure, that are constantly hounding me. "Oh, you're going to feel so much better. Oh, you're going to do this. Oh, you're going to do that." You know what? I've been studying on this for 10 years. I have been researching and wanting to have this surgery and studying on it for 10 years. I know what's going to happen. And I see myself getting pissed. And it scares me a little bit. I mean, I don't want to turn into a bitch. and Lord knows I can be one. I have a temper, and I can blow up with the best of them. I was in the Navy, and I can cuss a blue streak, and have been known to do so. But I don't want people constantly focusing on, "Oh, you're going to look better. Oh, this, oh, that." You know what? It is what it is. And that's one of the phrases I absolutely hate, and I just said it. I'm doing this to move. And I wonder if any of you who have had this already are feeling anything like that, or if you ever felt anything like that. It would be interesting to know. I know this is going to be a huge psychological process. There's going to be a lot of changes and a lot of growing and a lot of letting go of things. But there's some anger there, and I can feel it coming up. The other thing is, as I know that the pre-op diet is rapidly approaching, not really mourning for foods or saying goodbye to them, but kind of, yeah. I mean, it's been a week or so ago that my husband and I went out with a couple of friends and went to eat and had a drink, and it was great. And they said, "Hey, we ought to get together and do this every month." And I was like, "Yeah." And then I was thinking, I'm not going to get to do what they're doing. Sure, I'll get to hang out and have fun, but I'm not going to get to knock back a beer or, have a drink, at least not for a year. And even after then, I don't know that I'd want to waste the calories. I hope that after this is all over and I get to maintenance or whatever, that I won't need to be, I don't know, I guess I will. And I guess I want to be. I guess I want to be in a stage where I'm constantly scrutinizing everything that I put in my mouth, because not doing it is what got me here. And I don't want to be here anymore. I want to be done with this, and I want to be done with it forever. And if that means that I have to change as a person and do a complete 180, well, then I guess I'm doing a complete 180. I don't want to be back to this because it hurts and it feels uncomfortable and it hurts. To walk a flight of stairs and be sucking wind, or can't walk a mile, or hurts to stand, hurts to sit. The church I go to, we should be standing the entire time. I'm an Orthodox Christian, Russian Orthodox Christian, and we stand for 2 hours. And I love to sing, and they want me in the choir, and I've done that, and I am in so much pain by the time it's over with because I've had to stand the whole time. I don't want to be in that kind of pain anymore. I want to participate and not feel embarrassed because I have to sit down. I don't want to sit anymore. I don't want to be a bystander anymore. And that's why I'm doing this. If you've experienced anything similar, please let me know. Thanks. Sparkle on, guys.